Dr. Ataii here. We're going to be doing our very famous microneedling with PRP to address our lovely patient's melisma, which has been ongoing for multiple years. We've done 2 treatments so far. Last treatment was 3 months ago. We had a little hiatus because of some sun exposure that she was having. So we wanted to take a little break before we addressed her hyperpigmentation. To me, the pigment has lessened. It's not as pronounced, even though it's not gone. We're going to address the cheeks a little bit more aggressively with what we call liquid gold. This treatment is also sometimes referred to as the vampire facial. If we have plasma left over, we can do injections in strategic areas, and that's sometimes referred to as the vampire facelift. So the facial is essentially doing what we're doing now, what we refer to as the microneedling with PRP. The vampire facelift is when we actually take the excess plasma and inject it maybe in the folds, tear troughs, cheeks to add volume, and that turns into collagen over time. Pores are a lot tighter comparatively. I'm looking at the nose and certain areas where the pores are larger, and I think that's definitely helped. And the benefit is I'm not zapping you with a laser that can sometimes cause more pigment. Granted, I have to torment you one way or another. You can't come here and just have fun. Easy.
My husband's just like, okay, whatever.
It is what it is. Yeah, you can't change that.
No. How long between this can I do Botox or anything? I think
We could do it within a week.
Okay.
Yeah. All right, let's go to the middle. Just completing her microneedling with PRP. Patient's been very tough. She did great. You get moderate erythema, which means redness after the treatment, but it feels similar to a sunburn. Am I right?
Yes.
Yeah. Usually that redness subsides within a few hours. It's at least diminished quite a bit. And the heat sensation is because of, obviously there's about 30 needles that oscillate at a really high speed, so it causes a thermal type of heat reaction, but there is no heat involved in this procedure. As far as outcome, she'll notice after a week that her skin will have a glow to it. Usually these treatments are recommended once every 4 to 6 weeks, and most patients need a series of 3 to 5 sessions.